operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the Living a Longer and Healthier Life show. This evening, we're going to have Dr. Robert Eggerman on. He didn't fall ill. He's a podiatrist. We'll get him on in the future, so get better, Dr. Eggerman, and don't worry about it. We'll have you on in the future. We're going to talk a lot tonight about home health care. We have with us Lou Biasi, Vice President of All County Healthcare Incorporated. Lou, welcome to the program, and tell us a little bit about home health.
Well, David, thank you for having me on. And, we've been sponsoring the show for well over a couple of years now. And come to find out that a lot of people really don't know what they're entitled to under their policies, their insurance policies. Whether you have a Medicare Advantage plan, whether you have a straight Medicare plan, whether you're PPO, or whether you're just straight to Humana or whatever managed care plan you have. Healthcare has changed so drastically, as you even see on television, David. They're all arguing over healthcare. Every politician say we're going to come up with this plan, we're going to come up with that plan. They want to, but no one's come up with any plan.
It's really always a hot topic.
It's really saving the patient or the consumer out there any money. Costs keep going up. I hear patients constantly complaining about their cost of healthcare, cost of prescription drugs, cost of everything. The only thing that I can tell you right now is that under home care, under Medicare home care, it's absolutely free to the consumer. If you have Medicare, straight Medicare, Part A and Part B, or whether you've got a managed care program, managed care, which is Medicare Advantage program, a Medicare Advantage program, you're entitled to home care. And the question is, where are you going to get the best care, where are you going to get the best service? That is totally up to the consumer. The consumer doesn't realize that they have a choice to go to any and all agencies that they want to go to. The doctor doesn't have to, if you tell the doctor, hey, I want to go to All County, or I want to go to ABC, I want to XYZ, he has to send you there. Because a lot of times these doctors want to send you where they want to send you for reasons might be known to me, but
a lot of different reasons.
There's a lot of different reasons. Read between the lines, there's a lot of different reasons.
There you go.
So the fact that what we're trying to say is it's your choice. Now, we at All County, we have a 4.5-star rating with Medicare. Out of 5, we have 4.5 stars. We've been in it for 29 years, healthcare, serving Palm Beach, Broward, and Dade County. And as I said to you, home care is absolutely free to you, the consumer, to you, the Medicare person. So it's something that when the doctor orders it, it's amazing. I guess we get cases where a doctor will order home care and the patient needs it. And sometimes the patient refuses. And I try to find out why they refuse, because the doctor said you do need home care. And listen, if you're going to get home care, the reason why the doctor ordered it, he wants to make sure that you're healthier, if you go through surgery or whatever that may be, that you're either going to recuperate faster in home while you're out of the hospital, or for some reason you have a wound care, he wants it taken care of. And if you don't get it taken care of by an RN or an LPN or a physical therapist, you're going to get sicker and sicker and probably end up back in the hospital. So what we're trying to tell you, folks, if you have a doctor's order for home care, take advantage of it. Take the home care. It's going to cost you $0.
$0.
$0.
It's never going to cost them
It
anything.
doesn't cost you anything.
A lot of people don't realize that.
Well, it's amazing because I understand a lot of people don't understand their policy. I get calls every day. My mom got sick. Well, what kind of insurance she has? I don't know. Well, if you don't know the kind of insurance you have, you want some help, call us at All County Healthcare, 954-717-7027. We'll try to help you through whatever insurance program you have or where's the best place to go. All right?
Would it be a good idea for people to, if they're not sick right now, to take the time and learn a little bit more about what they have? So if it comes to a time that they're sick or a family member's sick, that at least they can share that info?
David, I can tell you, and I'm a senior, and I wouldn't know what healthcare was unless I got in the business, right? I was just before the show, I was talking to a podiatrist who's out of Greenwich, Connecticut, and he's explaining to me these different things, and today, medicine really isn't the medicine it should be. Right? Medicine is primarily, they're all in for cost savings, how much we can make, what's the dollar sign. Medicine is becoming, I hate to say it, but medicine is becoming more about money than medicine. Right? The old-fashioned doctor going to your home, that's not existing anymore. Someone's trying to come back. But the factor is, what's the companies you go to? And one of the things that home care, every home care offer, Medicare, home care, AZ, we offer all about the same things. We offer physical therapy. We offer wound care. We offer medical management, managing your meds. We also offer what we call behavioral health care, which was part of psych therapy at one time, and now it's called behavioral therapy. So we're into that with every single thing, with RNs, LPNs, PTs, OTs, occupational therapy. But the one thing that makes us different, David, is we finally come up with a program that we can now treat people with respiratory disorders, especially COPD. As you know, COPD is a non-curable disease. And what happens is the hospitals consistently, the person who has COPD is in and out of the hospital maybe multiple times in the course of a year. Because the hardest thing is you're suffering from asthma, COPD, pneumonia, and you can't breathe. Boy, that's frightening.
Yeah, that's frightening.
Sometimes you experience where you can't breathe, you can't get your breath. That's frightening. Well, I'm happy to say that we finally come up with a program through our respiratory therapy team that we've developed to treat COPD at home. And that COPD at home, we treat it with what we call IPV, Interpulmonary Ventilation Program. Now, the staff at All Kind of Healthcare has said, listen, we got to make this available to everyone. Not only to people that Medicare, but if you're non-Medicare, you're PPO, there is a charge to you personally if you're non-Medicare that you can pay for, but you get your COPD treatments at home. And I'm going to tell you, the results, the tests that we've been doing, the studies we've been doing, we're keeping the patients out of the hospital up to 12 months.
Wow.
Up to 12 months.
That's great.
The largest amount of, I guess, readmissions to hospital is due to COPD and respiratory ailments. I had a friend of mine, they came down south. She got pneumonia or COPD. She was in and out of the hospital in 4 weeks. She was in the hospital 8 times in 4 weeks. In and out. Came home for 2 days, back in the hospital. And frightening. But now you can be treated at home, and I can tell you, the seniors that we're treating, the people that we're treating at home, if you go to our website, allcountyhealthcare.com, and you read on our Facebook page what people are saying about our COPD treatments, if you have COPD, trust me, you're going to want the treatments at home. So if you're going to go to see a physician, you have COPD, and they're going to recommend home care, they're going to give you a nebulizer, say, listen, now some of the questions, David, to get home care by Medicare, there has to be called homebound status.
Okay.
What homebound status means is that you cannot leave your home without assistance. People say, oh, I can't leave. Homebound status means you can leave your home. You go to a doctor's office. You go to get your hairdresser appointment, haircut appointment for men. You go shopping. You go to religious services. But you have to leave it with some kind of assistance. So you can leave your home, but you got to leave it with assistance. But you can't go out and play cards every day, or mahjong every day, or some kind of game every day, or golf every day, and expect to get home care.
Maybe shopping, you can go shopping.
Well, you go shopping.
With the help of the assistants.
With assistance, right?
Okay.
You can also go to, now, even President Bush, he expanded that to say that you can even now go to family events, outings, with assistance. So that doesn't mean you have to be lying in bed all day to get home care. There are certain criterias. When our nurse comes out and does an assessment, they will tell you whether you qualify or don't qualify.
So they assess the home.
We assess everything. When our nurse goes out to do a home assessment, they call it an OASIS form. Our nurses specifically do a complete home assessment. They want to know what your medications are. I even have them check the refrigerator. Do you have enough food?
That's
There have
important.
been many situations where we found that the patient doesn't have the proper food, proper nutrition. They're spending more money on their medicine than they are on their food. So immediately we'll put a social worker in there to help them get the food that they need. All right? So there's so many opportunities for you if you only knew. That's what we're here. We're here to educate you, to tell you what's available for you after you go to the doctor.
And let me, so COPD is chronic obstructive pulmonary disease.
That's correct.
A lot of people get this. You said one of the causes is asthma. Another cause, obviously, this country did a lot of cigarette smoking.
Well, there's a lot of cigarette smoking.
Environmental, like sandblasting. I've talked to some people who've got it from that.
It could be sandblasted. It could be you worked in the Navy Yard for years.
And
with
it constricts the flow there in the lungs. And what your machine does, I believe, what is it, 20-minute treatments like a few times a week?
It's up to what you take 20, 30-minute treatments.
Easy.
First treatment now. No, it's not once a week. We give you 7 treatments in 7 days the first week and 4 treatments the second week.
Nice.
Now, it's amazing the results you're going to get even after the first treatment. What it does, and I'm not a pulmonologist. As you know, we have Dr. Keith Robinson. If you're living in Boca, folks, you've probably seen our commercials with Dr. Keith Robinson. Dr. Keith Robinson is a renowned pulmonologist in the area. He has one of the few privately owned pulmonary outpatient centers, rehab centers, called Fusion Health. He's an amazing gentleman. Right now he's in demand. He does speaking engagements all over the country talking about pulmonary disorders, right? He is just working with us. He's so into this IPV treatments for his patients, how it affects. He's a young doctor. He's experienced. He realizes what's happening. Some of the older pulmonologists probably don't understand it, don't hear about it. But as a young physician, he's in, let's say, a millennium who's learned about it, who really pushes this IPV treatment. Because what it does, it brings up all that congestion that's in there. When you go to the hospital, they're going to put you on a machine. I'm not a pulmonologist. I'm not going to give you all the terminology. But if you have a question and you want to talk to a pulmonologist, talk to your local pulmonologist. Dr. Keith Robinson available. If you want to get his number, you can call our office at 954-717-7027. Again, you can talk to your own pulmonologist. And if you go to your own pulmonologist, tell them, say, listen, I'm suffering from COPD, right? I want to know if I'm eligible to get these IPV treatments from All County Healthcare. He might not know All County Healthcare. He might not know what IPV is. If he doesn't, call our office. And we'll be happy to go to his office and explain to him and even show him how the unit works. We've done over the last 2 years, I tell you, we've done a tremendous amount of in-services to facilities such as assisted living, hospitals, etc. We went to Cleveland Clinic. We went to FMC. All the hospitals know now about our in-home treatment.
Nice.
We've invested. We're the only company, and we invested in 5 of these units. And I can tell you, these units are going constantly all day. All day they're going constantly.
They're workhorses.
And they're like, and the patients, the remarks that we're getting, again, if you go to our website and our Facebook, you'll see how the patients feel.
They're breaking up that phlegm all over South Florida and beyond.
You know, the old treatment was the old vest treatment. Mm-hmm. The original treatment was having a physical therapist pound on your chest, a respiratory therapist pound on your chest, to try to get the phlegm up. Mm-hmm. Or the vest treatment. It's very bulky, doesn't really work. It's hard to be, it's hard to stay in compliance. But the IPV unit,
it's percussive. It goes,
it goes right down into it, pulls out that phlegm that you're suffering from. And we've taken patients that in the middle of summer, 80 years old, have gone swimming and came back, and their wives were completely happy. They said it's amazing what the results are.
Lou, hold that thought. We're going to run an All County Healthcare commercial and be right back. The website is allcountyhealthcare.com. And we'll talk more about COPD on the other side.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the show. We're here with Lou Biasi, Vice President, All County Healthcare Incorporated. I see everyone watching on Facebook. We've had around 10 viewers. That's really great. Their Facebook site is All County Healthcare INC. Just type that into your search browser, and you'll find All County's page. Ton of info there. Every day they're posting health information. And don't forget about allcountyhealthcare.com. That's where you're going to get the info on the COPD, the interpulmonary ventilation device, the IPV treatment that we're talking about for COPD. And I just want to make a quick point, Lou. So a lot of people don't understand when they have home health care options. So they know they're getting home health, and they see that name at the top of the list. Well, like everyone's Googling all the, you get sick, you Google, the best pulmonologist or this and that. People need to take the time and search home health as well. You could go with anyone. You don't have to go with whoever the doctor tells you to go with, or the assisted living facility if you're there for rehab. That's the point I'm trying to make. Just like people are Googling conditions, ailments, doctors, they can take the time to Google you and get to your website, get the information beforehand, have it in their mental Rolodex.
Right.
That's what we're talking about here.
David, as you can see, we quoted our phone numbers 954-717-7027. That's locally. If you're out of that area and you want to call our 800 number, as you see on the screen, it's 1-888-717-7170. I don't want to confuse you, but there's two numbers. There's an 800 number, there's a local number. So those are the two numbers you can call us at. And when you spoke about people's referring, a lot of hospitals in the area have their own home health care division inside the hospital. You don't have to go with that hospital. And if you're in the hospital, say you're in one of the local hospitals that has a home health care company, they're going to try to steer you to their home care agency. That doesn't mean that you're going to get the best home care, because there's certain companies you can treat that might be better than All County Health Care in certain situations. I know our wound care division is one of the best in the whole country. Right?
So wound care, that's a nurse coming to the house to change the dressing on daily or bi-weekly basis, whatever the doctor orders. And your trained nurses come into the house. Mm-hmm. They make sure there's no fall risk. They make sure the wound's clean. Sometimes they even take pictures of the wound for the doctor, send it back to the doctor.
We take pictures all the time.
They're like the doctors.
Right. And this is one thing about All County. Our nurses are never told to do so many visits, because, Medicare pays by a set amount of money. And whether you do 5 visits, which is the standard to get paid, or you do 50 visits, you get the same amount of money. A lot of companies will try to stay within that 5-visit situation to get the most money they can. All counties nurses, as you can hear from Dina or any of our nurses, we give the patients what they need. If the doctor says daily, we'll do daily. That means they'll get 60 visits in 60 days. That's amazing, right? One company will say, well, I don't want to do that. I'm not going to make any money. It's not about money. It's about treating the patients for what they need, getting that senior back to where he is. Hey, our goal is to do 2 things. We want the patient to be safe. We want him to be healthier. And we want that patient to live longer. So our whole concept of our business is that with All County Healthcare, we're going to make sure you're safe in your environment. A, that your house is properly set up so you are safe. If you need handrails in the bathroom, if you have carpeting that's going to affect you from falling, we're going to tell you to change it. Our nurses are going to tell you, our PTs are going to tell you, watch out for that carpeting. You need handrails in the bathroom. You need handrails in the shower, right? If you need healthier, the nurses are going to tell you, make sure you take your medications, or the medications aren't right. Basically, you might have too many medications, right?
That's right.
Now, so the goal is we want you to live safer, we want you to live healthier, and by doing this, you're going to live longer.
Yeah, and get back to that quality life. Everyone,
you're right. So we all want to live longer. I don't care who it is. People say, I want to die. No one wants to die. We all want to live longer. We all want to feel better as we're going through it. So when you get a hospital visit, you get a physician's visit, remember, it's your choice, and if the doctor orders home care, you can tell him where you want to go. You don't have to tell the doctor, don't have to tell you where you're going. You say, I'd like to use All County Healthcare because I've heard Mr. Biasi on the phone, I saw their website, I saw what they do, and it's all about service. You know, we're locally owned, we've been here 29 years, you know, we've serviced anywhere from respite, custodial care, and the difference, there's many types of agencies. One only treats respite and custodial care, which with home health aides, and a lot of us seniors out there have home health aides. We supply home health aides also with the seniors. We supply the clinical staff. So we're doing it all. One call does it all. If you need an aide to stay with you 4 hours a day, we have that. If you need an aide to stay with you 24 hours a day, we have that. If you need a respiratory therapist, we have that. If you need a physical therapist, we have that. We have it all. One stop does it all.
And you service Palm Beach, Broward, and Miami-Dade.
Right.
So the Tri-County area.
Right. And the biggest push we have, we have one of the oldest licenses. Our license gives us the right to service 3 counties. That license is not offered anymore.
Huh.
So we have one license that's over 30 years old that offers us to serve 3 counties and 1 license. So we're working with servicing 3 counties. We have patients in Miami, we have patients in Broward, we have patients in Palm Beach, right? And any one of our nurses. And let me tell you, if you don't get the right treatment, you can call me personally at All County Healthcare. Tell me you want to speak to me, and I'll find out what the problem is, and I will make sure I rectify the problem. Because one thing I'll always ask my doctors and my patients, I don't care about how many visits, how was the service, how was the care? I just met a doctor today, and we met 2 doctors. Matter of fact, I went to a podiatrist. He was on last week. I had a piece of glass in my foot, and he sent some patients over. I said, let me ask you a question. How were your patients? Were they happy with the service? He says, the best service I ever had.
Nice. That's great to hear. Coming from a doctor.
Right. He says, my patient is the best service, and he was very, very complimentary with Peter. Peter was his marketing person. How Peter notifies about every situation. He loves that. You know, doctors are notified for any change in the person's behavior, any change in medications. Our nurses will call the doctor immediately. So you're never alone. You know, you can call our staff, call our nurses. We have a case manager always managing your case along with the nurses. And if you think you're not getting along with the nurse is a problem, call us, and we will rectify that problem. But we can say we're a 4.5-star rated company. We're 5-star rated as patient satisfaction. Our stars keep going up because, you know, as a senior, I want the best care. I wanted the best care for how I got in the business. I wanted the best care for my dad. Mm-hmm. They sent the nurse in. 3 months later, I bought the company.
Wow.
And I continue that whole concept about service. Being a senior, I want to make sure that I get the best care, and you seniors out there, I'm going to assure you, you're going to get the best care.
Yeah, and that number is 954-717-7027. It's allcountyhealthcare.com is the website. Like I said, they're on Facebook. Just type in All County Health Care
Twitter.
INC on Facebook. Twitter, yeah, big Twitter push lately.
We're Twitter.
I've been noticed that I'm on Twitter. So
We're also, what else we're on? Twitter, we're on...
LinkedIn, all the social media
Right.
websites. But you do a lot with your main website. Like I said before, there is that COPD care tab where people can go and just click and learn about that IPV treatment. And just let's say it again, it's Medicare approves that, so it's free to the patient.
Medicare approves it. Matter of fact, we give you your own mouthpiece to go forward. How much time we got left, David?
A minute, less than a minute.
Okay, mention one more thing. It's FDA approved. Our program is FDA approved, right? So the unit is FDA approved. The patients are getting, they're feeling tremendously with it. And the other thing I wanted to say is if you need any type of care, this is where to go, right? And the patients that we're dealing with, they're responding tremendously with our Facebook. And by the way, if you're living in Boca Raton, you've probably seen our commercial on TV now. We're running a TV commercial about IPV. And next month we'll be doing Delray. Thanks, David, for the time.
Thank you, Lou, and we'll see you next time.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on